Hi, Dr. Adam Goldman of the Metropolitan Vein and Aesthetic Center. I'm here to talk to you today about the topic of Varithena and hyperpigmentation. Varithena is a treatment for the superficial veins of the leg, as well as any communications that may be causing these veins. A common problem or side effect is hyperpigmentation or darkening of the skin where the original veins were located. When choosing a vein treatment center, it's important to choose one that has vein treatment specialists and extensive experience. We at the Metropolitan Vein and Aesthetic Center have participated in some of the early trials of Varithena and have years of experience with this treatment. During that time, we have developed proprietary protocols to prevent any kind of complications and to give you the best clinical outcome possible. Also, it's important to note that there is very little information on the internet about Varithena and hyperpigmentation. So I'm here today to give you an overview of that topic. The first thing I want to talk about are the causes of hyperpigmentation and any risk factors. So the cause of hyperpigmentation after the treatment is poorly understood. One theory is that after we close the veins, the body tries to remove them, and this is done through inflammation. Secondary to this inflammation, the body reacts and produces a chemical protein known as melatonin. Melatonin is what you see when you go out in the sun, and the body creates that to darken the skin to help prevent any further damage. However, in this case, that melatonin may cause some darkening of the skin where the vein originally was located. Another and more probable cause is that very often blood gets trapped in these veins that we treat. As the body removes that blood, the components of the blood, specifically iron or hemosiderin, is released. This is what can cause the darkening of the skin, similar to a bruise. However, in this case, it is more permanent. There are some risk factors for hyperpigmentation that we can use to identify patients more at risk. One is darker skin types. Second, if you've had hyperpigmentation from prior Varithena treatments, the likelihood is more likely the second time or third time. And finally, the larger the veins, the greater the density of the veins, the more likely that this can happen. The most important treatment of hyperpigmentation is the prevention of hyperpigmentation. And this is done in several ways. Firstly, the truncal veins or feeding veins should always be treated first. The greater saphenous vein, the lesser saphenous vein, the anterior accessory veins can all be treated with endovascular techniques. Once the flow of blood has been interrupted, it gives an opportunity for the superficial veins to decrease in size and density. Waiting a period of time and using compression stockings after the treatment is also important. Next, we use the same technique when you come to the clinic for the Varithena treatment. One may notice that when they're lying down, the veins often disappear, and that's because gravity is not allowing the veins to fill. When you come to the clinic, we put you in what we call a reverse Trendelenburg position, with the legs all the way up in the air and the head all the way down, and we leave you there for several minutes to help reduce the size and density of the veins. The only caveat is if the veins are very dilated and the walls have become very stretched out, this technique is limited in its effect. However, it should always be attempted. Next, when injecting Varithena, a slow injection technique is important. By reducing the pressure of the injection, we reduce the risk of extravasation or the Varithena leaking out of the vein. The less Varithena that leaks out, the less inflammation, the less the chance of hyperpigmentation. Next, the aftercare is very, very important. We use proprietary compression techniques after the procedure to help reduce the risk that blood will become trapped in those veins and cause hyperpigmentation. It is very important when getting the treatment that you follow our instructions exactly, as it will reduce the risk of complications. Finally, when there are numerous veins or they're very, very large, we always ask the patient to come back for a routine follow-up in 1 to 2 weeks. During that time, we can assess the results of the treatment and the amount of closure. And more importantly, if there is any trapped blood, it gives us an opportunity to remove it. This will help reduce the risk of hyperpigmentation and also decrease pain and improve healing after the procedure. Finally, I would like to talk about the treatment of hyperpigmentation if it does occur. The first and most important treatment is actually time. Often when the hyperpigmented areas are not so dense or dark in color and the skin tone is lighter, it will often fade on its own. Sometimes the process can take a long time, even up to 2 years, as the legs do heal very slowly. However, if one notices that it is fading, I usually recommend waiting, and then usually we'll end up with a good clinical or cosmetic outcome. The other thing that can be tried is chemical peels, medical grade chemical peels. Often multiple treatments will be needed, but this can often achieve a good clinical outcome or cosmetic result with fading or reduction in the density or darkness of these hyperpigmented areas. A chemical peel that can be attempted at home without a prescription is to mix apple cider vinegar 50% with water, place it on a towel, and lay that over the darkened areas. You then rinse that off, and this process should be repeated twice a day. If, however, you don't see any results after 1 to 2 weeks, unlikely it'll make a significant change, and that idea can be abandoned. Finally, if there are no improvement, we recommend using the Q-switch laser. This is the same laser that is used for tattoo removal. It is a challenging way to treat it, however, because the protocols that were developed for tattoo removal are not the same or applicable to this kind of problem. The other problem is that often the darkened areas or hyperpigmented areas are often close in skin tone or color to the natural pigment of the skin. The challenge being removing that darkened area without removing the underlying pigment and causing a white or a lighter spot in that skin area. In general, we start with very low energies and then we build them up slowly. So this is a lengthy process. After the initial treatment, we assess the results and see if we need to increase the energy or lower it and hopefully get a good cosmetic outcome. And in general, we will see improvement of the darkened areas and hyperpigmentation. In conclusion, it is very important to be treated in the center with experience and being a specialist, as this will improve the outcome and reduce the risk of complications. If you have any questions or like to schedule a consultation, please contact us. We are on the web at www.nymetrovane.com or on Instagram at nymetrovane. You can also reach us at either of our clinics, one in Manhattan and one in Corona, Queens. The phone numbers are listed below as well as on the website. Thank you very much for watching.